Does the sun cause cancer? No, not directly. Sunburns cause cancer. So you can be out in the sun and receiving exposure, and as long as you're doing it intelligently and not burning, you're not increasing your cancer risk. In fact, you're likely decreasing your cancer risk. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. We get vitamin D from the sun, and the sun is by far the best source of vitamin D for us, more so than food, more so than supplements, although we need to use food and supplements more and more these days because we're out exposed to the sun less and less. What are the best vitamin D containing foods? Those are things like organ meats, liver, and egg yolks. Many people, especially in the US, don't eat organ meats at all, aren't fans of liver, and are scared of egg yolks because of what the media has been promoting for years and years. So many people aren't getting enough vitamin D from their diet, and even if you're eating organ meats, liver, and egg yolks, you're still not getting enough vitamin D from your diet. Now, besides the limiting diet, most people do not live near the equator. So not living near the equator means the angle of incidence of the sun's rays as you move higher up in latitude is less and less direct. So even more sun exposure is providing less vitamin D than you think. So as you move more north, the angle of incidence is worse, so you're getting less vitamin D from your sun exposure and therefore need vitamin D from supplements and food and other sources. Studies have even shown that multiple sclerosis, which has been associated with vitamin D deficiency, is more prevalent the higher you go in latitude. So the more north you live, whether it's in the US or in Europe or anywhere, the more north you live, the higher the incidence of multiple sclerosis in this case, due to the association of vitamin D. Other reasons that vitamin D is going to be insufficient. If you have an inflamed gut and fat malabsorption, vitamin D is a fat-soluble vitamin. So if you have gut inflammation and you're malabsorbing fat, then you're not absorbing the fat-soluble vitamins well. So that's vitamin D, that's vitamin A, that's vitamin E, that's vitamin K. So that's another contributor to why you could be deficient in vitamin D. Now, what does vitamin D do for us? Vitamin D, we started the video by talking about the sun not causing cancer. Sunburns cause cancer. Well, to oppose that, proper sun exposure is the best source of vitamin D, and vitamin D has anti-cancer properties, specifically against prostate, ovarian cancer, and breast cancer. So proper sun exposure, creating optimal vitamin D levels, is actually anti-cancer, especially those site-specific cancers. Vitamin D is well known to be critically involved in healthy bones. So as you age, and if you're worrying about osteopenia or osteoporosis, your vitamin D level is key, so sun exposure is key there. Vitamin D is very important in sleep quality. Studies have shown that vitamin D plays a role in optimizing your sleep via the light-dark cycles. Evolutionarily, humans have lived and developed and co-evolved their circadian rhythms with the light-dark cycles of the sun. So vitamin D and just living along with the circadian rhythm of the sun is going to optimize your circadian rhythms, optimize your sleep. Vitamin D is key in mood and mood disorders. If you're lacking vitamin D, you're not properly opposing neuroinflammation. Neuroinflammation leads to anxiety, depression, etc. So vitamin D is very key. And lastly, vitamin D is very important in immune regulation. So again, this plays into the cancer picture, but vitamin D is a great promoter of T regulatory cells, and T regulatory cells are the cells of the immune system that calm everything down and kind of conduct the orchestra. So if you're vitamin D deficient, you likely have insufficient or suboptimal T regulatory cells, So the calming function is lacking, therefore you may be pro-inflammatory, and the immune system may be hypervigilant at going after self, which could lead to autoimmunity, and not performing proper surveillance for carcinogenic, tumorigenic cells. So, does the sun cause cancer? No, sunburns cause cancer. The sun actually provides us with one of the most important nutrients we could possibly have, and the sun is the best source. So you don't want to avoid the sun for fear of skin cancers. You want to intelligently expose yourself to the sun and get enough sun each day, and then adjunctively add more vitamin D with your diet and with supplements so that you can have proper levels. If you don't know your levels, then you should have your vitamin D levels tested by your practitioner so that you have a baseline and then can move forward with sun exposure, diet, and supplementation in order to raise your level to optimal, and then you can retest to know if you've done that or not.